So when you're ready to go, you want to make sure that you have all of your supplies. This is the AeroCat chamber here, so this will be different sizes depending upon if you have a cat, a small dog, a large dog. Your vet will make sure to give you the size that's correct, as well as the correct size face piece. So right here is the opening that you're going to put your face piece in. You'll have to assemble it the first time you use it. So this little kind of spout area goes right into this opening here. So it's rubber, so you might have to kind of twist it and wiggle it to make sure that it's tightly in there. You just want to make sure that it's all the way down in there pretty tight so that it stays airtight and all of the medication can go to your pet. And then when you get your inhaler, it'll come with a little white cap on it here. You want to take that off. If it's the first time that you use your inhaler, you want to prime it first, so give it a good shake and just do one squirt to make sure that it's primed and ready to go. And then this opening here on the end of the chamber is where you're going to put your inhaler. So you can take your inhaler, push it in right there. It fits pretty snugly, which is exactly what you want. So you can see there's no holes on the side, and then it's ready to use. When you're ready to go, you want to have your pet next to you, again, wherever they're comfortable, especially with cats. Sometimes if you try to put them in a position that they're not comfortable with, they'll struggle more and it'll be more stressful. So kind of wherever they're comfortable. If you find that they're very comfortable wrapped in the burrito, you can do that. If you find that they're just comfortable sitting on your lap, that's fine too. If they're sitting on your lap, I will say it's sometimes easier to have them face away from you so that when you're ready to do the inhaler part, it's just easier to kind of hold them in one place. But wherever they're comfortable, you can start with. I'm going to start with this cat right next to me. I just find that it's a little bit easier to keep them kind of next to you, and you can have your inhaler here. In case they move, it's easier to keep them where you want them. So for cats, we actually recommend doing the pumps before they're on their face, just because it can make them a little bit nervous. So you can put your hand over the edge here just so none of the medication leaks out. And you're going to take your inhaler, so your finger on top, and do 2 pumps. You should hear the noise when it pumps, and then you're going to take this and put the mask right over your cat. So you should have the mouthpiece create a nice seal around there. You want to put a little bit of pressure, not too much that it's uncomfortable, but that it creates a nice seal. And then you're going to wait for them to take 7 to 8 breaths. So if this was actually a patient that was breathing in the medication, this little flap here will flap up and down with each breath that they take. So you can count that way. Sometimes it's just easy to feel their breathing and make sure that they take a couple of breaths just so that they breathe in the medication. So you're just going to wait there until they take the appropriate number of breaths, and then you can take the mask away, and that's it.